and welcome to my talk on skincare. I'm Stacey Folk, and I am hoping that this will serve as a resource either before or after your consultation or just as a refresher. Now, you know good skincare is essential regardless of your stage in life. Your skin is really fluid and ever-changing, not only throughout the years, but even seasonally and on a daily basis. So your needs are always a moving target, and the better equipped you are and more educated you are about what's available, the better your skin can look. I'm hoping that the more you understand the what and why of skincare products, the more apt you are to use them appropriately and then reap the benefits of having more beautiful skin. There are intrinsic factors that affect the way our skin looks, and most notably, it's our chronologic age. Oxidative stress, which is kind of like the rusting or breakdown of our body, and genetics play big roles in how our skin looks. We might be able to influence this a little bit, but for the most part, it is beyond our control. Now, extrinsic factors have a huge influence in how we age, and we absolutely have some degree of control over these. Sometimes it's the good life that ages us, the ability to spend time outdoors in the sun, living at high altitude like beautiful Colorado, and taking part in outdoor sports. But sometimes it's also the bad stuff like smoking, pollution, extremes in weather, bad diet, dehydration, and poor health that has a huge impact on the way that we look. So, if you don't know this already, I'm kind of the queen of analogies, and I like using tree bark as one for looking at the surface of our skin as we age. So, the bark of an aspen tree is smooth and more even, and that's more like younger skin. As we age, the outer layers of our skin become more irregular, bumpy, discolored, and rough, like the pine tree. We want to keep this ugly layer of our skin looking thinner and more even, like it is when we are a young aspen tree. These deep layers of skin change tremendously as we age as well. I kind of think of the deep layer as the pretty layer of our skin, and this is where the cells are located and where they all build lots of collagen. It's kind of like the Spanx layer of our skin, and it gets thinner as we age. We certainly want this to be as thick and elastic as possible, right? So I really broke products down into three categories: those that protect your skin, those that correct your skin, specifically we're talking about hyperpigmentation, and then those that stimulate cell production and collagen production. You might also think of protection as what you do in the morning with sunscreen, antioxidants, and things that help to protect your skin through the abuse that it sees during daylight, and then everything you can do to give your skin the ability to correct itself and to build healthier layers of skin and more collagen overnight. The cascade of events that happens to your skin when it's exposed to the sun is nothing short of horrifying and is responsible for about 80 to 95% of the changes we see to our skin as adults. Yet 70% of women do not use sunscreen daily, and I will not accept it's in my makeup as an adequate way of protecting your skin unless you work as a professional geisha or clown. Now, in 2011, the FDA required more honesty on packaging about the UVA and UVB protection and the sun protection factor, the SPF. So what we found out is really the claims that are made on these packages are good for about 2 hours. Unless you are reapplying, you're not going to maintain that level of protection. So if you're indoors all day at work, you're not breaking a sweat or touching your face a whole lot, you're probably going to be good with one application in the morning. But if you are going to be outdoors, you do need to protect your skin every 2 hours by reapplying. And we love to get people to the point that they are just using their sunscreen every day. So we're not talking the typical sunscreen that you buy at a grocery store, but more sophisticated day creams that are sort of a one-stop shop for everything that you might need in the morning. So in addition to getting your SPF and your sun protection, you can also have products that include antioxidants like vitamin C, which you always want to include in your morning regime if possible. Also, some contain peptides, enzymes that reduce sun damage, growth factors, hydrators, moisturizers, skin skin lighteners and brighteners, and even some contain pigment that can give you a real light finish to even out the skin, or a more heavy concealer type coverage if you have lots of hyperpigmentation, or if you're healing from a procedure and still have some residual redness. These are just some of our favorites. We have tons of products, each with different bells and whistles. And when you come in for a skincare consult, you can select one that's going to be as inclusive as you need and have all of the different kind of add-ons that might work best with your skin type. Let's change gears now and start talking about correction, and more specifically, the correction of hyperpigmentation or brown spots. Now, when you're young and you're out in the sun, you tend to develop more of an even tan. But as you get older, people notice that they don't tan quite so well, but they develop a lot of brown patchy areas on your skin, and this is hyperpigmentation. It's due to melanin, which is produced in cells deep in the skin, which then gets transported up to the surface. So when you see a brown spot on your skin, it's not necessarily like paint on the wall. It's more like you spilled coffee on your bed, and it soaked through all of the blankets and through the sheets and into the mattress pad and into the deeper into the mattress. So it takes a long time to get that brown out of the skin, because you need to turn over all of those cells in order for it to actually be removed. I like to think of these brown spots like they're little protective brown umbrellas that your skin puts up to protect itself from the sun. You also have skin lesions or patches on your skin where this pigment likes to accumulate. So the pigment can be lightened out of these lesions, but the lesions don't go away. So without good upkeep, you're going to see a return of those brown spots over time, kind of like weeds in your garden. So the melanin production pathway is pretty intricate here. And this is what's happening in order to make that brown pigment. If you can disrupt any of the steps, typically the most popular is a tyrosinase inhibition. And of course, I'm not going to quiz you guys on this later, but you can see if you can break up this cascade of events, you can stop your melanocyte from being able to make the brown melanin. Skin brighteners and lighteners are often referred to as bleaching agents. And while it's not at all accurate because it's not really bleaching, it is a good way of understanding what it's doing. The most popular is prescription strength hydroquinone. And hydroquinone is a tyrosinase inhibitor, and it's in lots of products, used a lot in Obagi skincare products to help brighten the skin. There are also a number of good botanical skin brighteners, which may not be as effective, but can be used in conjunction, or you could also consider going back and forth and alternating which product you're using throughout the year. It takes about 2 weeks for the hydroquinone to start working. And now that the pigment is not being added to your umbrella factory, umbrellas are still being made, but somebody stole the brown paint. So the next time your skin is trying to protect itself and throws up a bunch of umbrellas, they're all clear. And that looks a lot prettier than a bunch of brown umbrellas. Melasma is a different condition than just typical hyperpigmentation. The brown spots are more large coalesced patches. It has a genetic component and is due to hormonal overstimulation of the melanocytes. You may have heard this described as the mask of pregnancy, but when it happens when people aren't pregnant, it's kind of like a long-term chronic condition that needs to be more managed rather than resolved. So primarily, you're treating this with skincare, and it's best to avoid any kind of irritation from the light or from strong products, and even broadband light or IPL treatments, which can make this worse. You can do peels and you can use lasers, but again, primary treatment for this is skincare. These are our hydroquinone products that we carry: Obagi Clear and Obagi Blender are the most popular. These are not for use during pregnancy or when you're nursing. If you are using skincare alone to treat hyperpigmentation, I would recommend that you use the entire Nuderm system. It's 5 or 6 steps that have been arranged, and they're all labeled, and it's actually quite easy to follow the regime. And that is an extremely effective way of using skincare alone to help control more more severe or dramatic hyperpigmentation. These are our most popular botanical skin lighteners. White lightening is chock full of great botanicals that help to disrupt that melanin pathway. Even Up is a really unique product that not only has your sun protection with a water resistant SPF 50 and their own proprietary batch of skin brighteners that are all botanical, it even has a heavier foundation coverage, so it's great if you have a lot of irregular reds and browns in your skin or if you're healing from a procedure. The Nouvelle from Neocutis has not only retinol, but also their proprietary Melaplex batch of botanical skin brighteners to help lighten your skin. So, if pigment is your problem, first and foremost, you need to protect your skin from the sun. Do not be afraid to use multiple products at one time. You can also consider rotating between hydroquinone and botanicals throughout the year. You definitely want to include retinoids, which we're going to talk about in the next section, and understand that it takes time to get rid of the brown spots, but hardly any time at all to get them back. You can accelerate your results with procedures such as chemical peels, broadband light or phototherapy, microneedling, and lasers. Now we're on to stimulation. We know that we need more cells, more collagen, and more elastin as we age. Retin A is hands down the most powerful skincare tool for stimulating the skin. We also use growth factors now, which are fairly new, to stimulate cellular growth and healing. Again, retinoids help with the correction of the hyperpigmentation as well as stimulation of your skin. They're derivatives of vitamin A, and with consistent use, they normalize cell function that becomes more erratic with age. It increases cell turnover, and you'll see the flaking off of the outer layer of those dead cells. It unplugs pores, increases the retention of collagen by reducing collagenases, which are enzymes that break down collagen in response to sun. It reduces pigmentation and thickens and brightens your skin. Retinoids are another group of skincare products that should not be used if you're trying to get pregnant, are nursing, and if you are having any facial waxing done, you need to be off these for at least 5 days. If you're having any other peels or procedures done, be sure to discuss your use with your provider so they can tell you when it's ideal to stop them before your procedure. So, what scares people away from using retinoids is the retinoid reaction, which you're pretty much going to see in everybody. It is time limited. It can last anywhere from several weeks to a few months. And this is why we recommend that you start these products slowly, typically every 2 to 3 days at the very beginning, and then increase in frequency. And your goal is to be on something daily. So, the retinoid reaction is a little bit like the ugly before the pretty. You may experience peeling as those dead skin cells slough from your skin. You may get a little stingy, itchy, or red. You would likely see a temporary increase in acne, which only lasts a couple of weeks, and your skin's going to be more sensitive to the sun. This is all temporary. It may last anywhere from weeks to months, but this is it working. It can be managed easily with regulating the frequency with the products, using a lot of supporting products that add moisture and protection and antioxidants, and some patience. You will get through it. You may have to adjust the strength of the product that you're using, but typically at the beginning, it's just the frequency with which you're using it. So, retinol is a weaker and milder form of a retinoid, and this is usually a starting place for patients that have more sensitive skin. It's not the active ingredient, but when it's applied to your skin will convert it into the active ingredient, retinoic acid. Conversion rates can be low, and it's quite variable from patient to patient. It does come in different strengths, and I would recommend you not use the over the counter products, as what we carry can be upwards of 100 times stronger than what's available over the counter. The two popular ones that we carry are Nouvelle, which is our weakest retinol. This is great. It's at 0.6%. and it's great for people who have very sensitive skin. Retinol Complete is also a wonderful product that has 1% retinol, and it's also chock full of lots of different antioxidants that are great for your skin. Retin-A is the big daddy. This is the active ingredient, and it is our goal that you will ultimately be on Retin-A. Again, because it is stronger, it is more effective, and you are going to experience a little more initial peeling and irritation, as well as redness when you're starting this. So again, you start with lower frequency, using it every other day, and gradually increase to daily use. You also, over time, will increase in strength. Renova is 0.02%, and that is our weakest retin-A. The 0.05% is probably our most popular for those who have been on a retinoid for some time. The 0.1% is pretty strong. So if you have more oily and sebaceous skin, this is the product for you. If you are more dry and sensitive, you may never get to the 0.1%. If you don't believe me so far, just look at this picture. The more purpley blue layer is the layer of cells, and on the left-hand side, this is control skin. In the middle, marked ROL as retinol, and to the right is retin-A. Look at how much thicker that cell layer gets. And then deeper is all that collagen. In the pink layer, you can see many more fibers and more robust collagen. And this is what happens when you're using a retinoid product. To recap, retinol is like your skin's drill sergeant, and it's going to make your skin cells get in line and perform. Retin-A is just a little more intense. Growth factors are one of the big new things to hit skincare products. And at the time of taping this, we were carrying 3 different lines of skincare products that contain growth factors. They are naturally occurring substances that stimulate cellular growth and proliferation. They also help with healing and cell differentiation. There's a problem with growth factors, though. These molecule sizes are quite large, and it can be difficult for them to get into the skin. They work better on your face, where you have more hair follicles, and that is actually a place that they can impact it. They work less well on your neck and on your chest, unless you've just had a procedure like microneedling or laser, where we have opened up channels and we can deliver these growth factors immediately into your skin. This has really been wonderful for people healing from laser procedures and getting maximal benefit from additional procedures like microneedling. Neocutis is definitely one of my favorite skincare lines that we carry, and they have a very unique type of growth factor called processed skin cell proteins that come from a fetal cell line. So when we harvest growth factors from cell lines, it's a one-time donation, and this was a 20-week-old fetus that had a non-survivable birth defect called anencephaly. Now, 20 weeks is very interesting in medical research because that's a time when fetuses don't form scars. So the cell line was used for lots of different kinds of research, for healing burns and for a variety of things. What they realized is that these cells will secrete growth factors when they're grown in a lab, and a one-time donation can be used indefinitely. And these growth factors help to stimulate type 3 collagen, which tends to dwindle out as we get older. Neocutis is considered kind of the Cadillac of products that carry growth factors for skin. Omni products have really revolutionized my healing from more aggressive procedures that we do in the office, like microneedling and lasering. These growth factors come from a neonatal cell line. It was actually donated for skin from one lucky individual. And the way they harvest their growth factors, they're quite proud of. We apply these growth factors directly after procedures, and I think it's cut my healing times down by almost half. I've been tremendously impressed with these products. Products from IS Clinical contain a growth factor called copper tripeptide, which is different from the others in that it's bioengineered. You can find this growth factor in their Youth and Super Serum, their Youth Eye Complex, and also the Youth Intensive Creme, which is one of our favorites because it's probably not only like wonderfully luxurious and fantastic, it is the only product I think that we sell that actually smells good. One thing you're going to hear a lot around our office is something called a skin prep. If you're doing broadband light treatments, microneedling, laser procedures, we want you to get the best result possible and we want you to be able to maintain your results. Because all of these are very irritating, we know they can stimulate hyperpigmentation. So, a big component of a skin prep is to go on hydroquinone, usually the Obagi blender or clear, or you could substitute in a botanical. We also want you to be on a retinoid because this is going to help get rid of the dead layer on the surface and rev up the number of cells that you have. You're also going to need to add some moisture, and hydrating serum is one of our favorites. It is hyaluronic acid, and these molecules are basically water magnets in your skin. It soaks right in, it's completely non greasy, and each molecule of hyaluronic acid here can hold 1,800 times its weight in water. The lasers that we use are really targeting the water. That's what they're looking for. So, the more hydrated your skin is, the better. This is also a great time to be using our Youth Intensive Creme because if you're starting a prep pretty quickly, if you haven't been on these products for some time, you're going to really benefit from that extra moisture and the copper tripeptide growth factor that's in this as well. There's also tons of antioxidants that will help you to heal your skin. Don't forget your eyes. People really need to take care of that delicate skin around their eyes. We carry multiple excellent eye creams. The Youth Eye Complex, has copper tripeptide, the Lumiere, which has the PSP, and DEJ which is great for building elastin. Don't forget, longer lashes make you look younger, so you might also want to add Latisse. Revox 7 is a new and very unique product, which is also awesome for around your eyes. It helps to smooth fine wrinkles by using neurotransmitters that inhibit muscle contraction directly below the skin. It's kind of like Botox in a bottle, but really more of an adjunct. So if you're used to getting Botox in your crow's feet, but you still get a lot of crepey activity closer to your nose, this is a perfect product for you to be using. I use it around my eyes and also around my mouth for those fine wrinkles around the lipstick lines. This is something you would put directly on your skin after washing, just a tiny amount, and you would use this twice a day. So, peptides are building blocks of collagen, and these are two really awesome products. Your neck deserves some love. So, Nectifirm is a product that you can use specifically on your neck and chest area that will help it to look more firm and lifted. DEJ is a similar product that's used for the face and also has an eye cream that helps build elasticity. I'm always a little embarrassed when people ask what I use for my skincare. I sort of consider myself the Imelda Marcos of skincare products. If you don't know who she was notorious for, she was the first lady in the Philippines and had like a bazillion pairs of shoes that they actually have in a museum right now. So this is an actual picture of my medicine cabinet, and I even have more products on the counter. And the good thing is I use pretty much everything. I may use anywhere from 5 to 10 products a day. I like to use a different growth factor in the morning than I do at night because I'm not sure which one is better. I'll use a different eye cream in the morning compared to night. I definitely use my Retin-A every night, and I use blender. I mix it with my blender and use that every night, depending on what I'm doing that day, how dry or oily my skin is. I will use different hydrators and moisturizers and also different antioxidants. One thing for sure, I never would expect anyone to have as many products as I do, but I hope that whatever products you do have, you will use as religiously as I do. So, to break it down in the morning, the first thing you want to do is cleanse. If you don't have a Clarisonic, it is a worthwhile and wonderful investment. Then you think of the steps with protection. The first thing I always do is hydrate. I use hydrating serum every time I wash my face. Then you want to add your antioxidants, such as a vitamin C, and then your day cream, which is going to contain your SPF. Also, most likely, you can pick a product that contains hydration and antioxidants if you want to be simple. If you want to build on more products, you can use a separate step for each one of them. The extras, you could use an eye cream, you could use your Revox, you could also use growth factors. And if you're really trying to tackle some hyperpigmentation, you can use a skin brightener in the morning as well. At night, you should again cleanse your face. And again, I add my hydrating serum right after I wash my face. Now it's time to repair. I'll mix my Retin-A with my hydroquinone, and then I'll also add growth factors and moisturizers as needed. Again, eye creams are excellent to be using twice a day. If you need to add some extra exfoliation, you can add it at this time too. And I put my Latisse on right before I go to bed. So, for best practices, I want you to cover the basics. You need to protect your skin, you need to correct the problems with your skin, and you need to stimulate more cell growth and collagen production. If you're going to get these products, use them. You can't believe how much is sitting in people's drawers that they're not even using. Be on the strongest retinoid that you can tolerate daily. Whether this is retinol or retin-A, you want to be on the strongest one that you can stand using every single day. Don't get stuck in a rut. Some people use the same skincare products for years and years and years and never change. Become more sophisticated or advanced with product use over time. Once you get used to using some things, maybe see what you can add to get even better results. And remember that skincare is key to maximizing and maintaining results from more aggressive procedures like broadband light, microneedling, and lasering. So you can come in anytime, make an appointment with one of the nurses or one of the PAs or Stephanie, our esthetician, to go over what products are best for you. Bring what you have at home now so we don't create any duplications. And we have a great photo imaging system called a Visia that can take very detailed pictures of your skin so you can learn more about what's going on and also can monitor your progress over time. Thanks for your time, and I hope that this was helpful.